Greetings. What if we can salvage the diabetic foot by identifying the diabetic foot ulcer at an early stage? How can we implement an effective program to eliminate the stigma and improve the diagnosis and prognosis and the monitoring factors for diabetic foot ulcer patients, even at a grassroots level, including primary healthcare? The agenda for this presentation will be to incorporate artificial intelligence powered active screening for diabetic foot using a novel app that the students of Christian Medical College, Vellore, and IIT Madras have developed to address the issues related to patient counseling using a personalized anonymous multilingual chat platform which is powered by AI. Leonardo da Vinci has said the human foot is a masterpiece of engineering and a work of art. But in India, around 45,000 legs are getting amputated every year due to the consequence of diabetic foot ulcer. And diabetic foot is one of the most devastating chronic complications of diabetes and is the leading cause of lower limb amputation. Around 75% of these amputations are a result due to a secondary infection, which are potentially preventable. And around 41 million population of these diabetic persons in India, they do not even see a specialist in their lifetime. There is always some lack of trained professionals throughout the country, insufficient knowledge about them, and there is lack of awareness about the diabetic foot care in India. Tragic rule of 15 is something that has been derived from literature. Around 15% of the diabetics develop foot ulcers in their lifetime, and among these patients, 15% of them develop osteomyelitis as a secondary infection. These 15% of the foot ulcers, they require amputations as well. There is something called a tragic rule of 50s. 50% of the amputations are at the transtibial or transfemoral level. 50% of these patients require a second amputation in less than 5 years due to an infection. 50% of these patients die within 5 years, and we can see that the mortality rate is very high, and this issue needs to be addressed at immediately. So what are the pressing issues that we have? The pressing issue number one is to monitor the diabetic foot in PHC setup, which is actually a difficult job for the physician there. To also follow up these diabetic foot ulcer patients and monitor their prognosis, and to eliminate the psychosocial stigma among these patients. So when we talk about monitoring of diabetic foot in PHC setup, it is always difficult to access the data from the patients. So that's why we have developed a high fidelity prototype of an app that we have. So this is the website version that you're seeing, the diabetic foot care app. So we have the doctor dashboard, and all these registered patients in the app will be alerted to the doctor, and the pending requests are also being alerted time to time. So through which the patient's details can be accessed by the doctor. We have every visit entry being documented by the patient and also the doctor, so the doctor can add all these lab results and the lipid profile and whatever investigations that are there to monitor the hyperglycemia of the patient and all the associated complications with it, so that he or she might understand the risk of developing the diabetic foot ulcer. This is the most important thing, to document the clinical findings. Most of the times, the physicians fail to identify the inspectory findings of the foot. So, we have skin changes, which can be erythema due to inflammation. We have signs of infections, dryness due to autonomic neuropathy, which sets in very early, fissuring of the foot due to mechanical stress, and also clawing of toes. And description of the ulcer should be documented every time when the patient visited through this app, so that we can help to screen for diabetic foot ulcer, and it will also be helpful to prognose, like find the prognosis of the patient. We have the additional doctor notes, which include the other investigations of choice for diabetic foot disease, which includes ankle brachial pressure index, monofilament, and durometer. So how do you identify the prognosis? So we have a special feature in this app through which the patients can upload the image of their foots from time to time, and these images will be analyzed by artificial intelligent powered GPTs to analyze the changes in the foot and let them know whether it is immediately something that has to be addressed immediately by the doctor, whether they have to change something, and the observations made by AI will be documented in this site, and this will be very helpful for the patients who are not yet sure whether their wound is due to their diabetes or not. So all the self-reported entries by the patients include the details that they're doing, the lifestyle factors including smoking, alcohol, chewing tobacco, and other factors that might affect, and including the exercise, the lifestyle. Along with that, they have their own food images that can be uploaded every like time to time, so that the physician will have access to all of that. We have a new patient data entry portal where the patient can enter their data and the other optional lifestyle factors as well. So this is a sample patient profile. We have all the patient information and all the doctor visit entries along with the patient self-reported entries. This is the revolutionary thing that we are talking about. So the monitoring comes from the patient and the awareness for the same will be with the patient. So whatever doubts that they're having, whatever stigma that they're having to show these ulcers to people, to go out and to talk to a physician, is solved by this issue where the patient can themselves take a picture of their foot and upload it in this particular site, which is confidential and it is protected, and only the physician can see that and make comments on the same. At the same time, the artificial intelligence powered companion is helping to identify the particular findings in the foot and let the people know whether it is an urgency or not. Talking about the psychosocial stigma, we have the patient group chat where we involve the other patients from different groups of the similar condition of ulcers, and they have their own doubts being sorted out, where the patients can talk to themselves, to their peers, and identify their fears, and also to have a healthy conversation in treating this diabetic foot ulcer. We sincerely thank everyone who has been listening to this presentation. Our team members are Gopal Krishna Mishra, I'm Manuel Inbam, and Nisha, all three of us from same Sivalur, and we have a good friend joining us, Mahan Parida from IIT Madras. Thank you all. I hope this was a wonderful presentation that can be implemented in the near future to salvage diabetic limbs. Thank you.